Hello, I'm Tim Sandle and welcome to my 10th video in this series about coronavirus. And the objective of all these videos is to give a different perspective to perhaps what you're hearing in the general media in relation to coronavirus related matters. So last time we looked at factors relating to the built environment and leading to a discussion about whether shops should open, but also some general advice about how to work safely in offices. And you can find this along with other videos in this series on my YouTube channel. This video, I want to return to the subject of social distancing. And we need to remind ourselves that social or physical distancing is of great importance, and a new World Health Organization study published in the medical journal The Lancet in June 2020 concludes that separation and keeping a distance is still the most effective method of protecting yourself from COVID-19 transmission, in addition to hand washing or hand sanitisation. And social distancing around the world varies between 1 metre and 2 metres, and there's some variance in between, like the US for some reason has 1.8 metres. As we covered before, the 2 metres or greater makes sense because the potential distance that droplets can spread, like via a sneeze, can go around 1.3, 1.4 metres, as we looked at in a previous video. So at 1 metre, the chance of becoming infected is based on another study in the Lancet by Chu and colleagues, is 13%. So that's at a distance of 1 metre, your chance of contracting coronavirus from someone who is infected is around 13%. At 2 metres, this drops to 3%. And then there's a 50% reduction thereon at each further metre distance. So the key thing there is that it's around 3% at 2 metres. And you can look that study up also in the Lancet. But there are other factors that affect the social distancing concept as well. One is time. So the thing is that no matter at what distance, after a period of time, the risk of infection does increase. So it's kind of logical that the longer you're in proximity with an infected person, then the greater the risk of transmission. Another variable is it depends on what the infected person is actually doing. So, for example, sneezing over a shorter period carries a greater risk than somebody talking over a longer period of time. Although with talking there are variants with talking normally and with shouting, for instance. But sneezing or coughing carry greater risks than talking. And there's also been considerable debate about when social distancing measures should have been introduced. So from my perspective in the UK, there's a general agreement amongst the scientific community that social distancing was introduced too late, and perhaps it's been unravelled too early. And in relation to this, there's some new research from the University of Austin, Texas, that finds that each COVID-19 outbreak lasts days longer for each day's delay in implementing social distancing. So for this research, the scientists looked at 58 cities around the world, and this showed that implementing social distancing measures late enables the SARS-CoV-2 virus to spread further compared with situations where social distancing was put in place more promptly. And the overall epidemiological assessment shows that for every day a city delayed implementing its social distancing measured following the appearance of the first case, then this adds 2.4 days on average to the length of the subsequent outbreak. This also carries future considerations should a second wave of outbreaks occur. And here the research infers that delaying by a week of putting social distancing measures back into place and enforcing those quite severely could add a further 17 days of the length of time that a second wave will be at its peak for. And a second wave is possible, and a major risk arises from putting measures in place relaxing too quickly. And with easing the lockdowns, if measures do backfire, then this will potentially double the infection rate based on this same research paper. So if the infection rate balances the recovery rate, then generally infections remain constant. Or infection rates fall, then this could push out the possibility of an infection rate entirely. But if the infection rate doubles, then it does lead to the chance of a second wave much more strongly occurring. And social distancing also helps with track and trace schemes as well. And there is a relationship between the two. So here, a third piece of research I want to highlight from South Korea found that public disclosure about contacts connected with potential symptoms provided more important community information, enabling people to take physical distancing measures. And such measures based on mathematical modelling will help reduce projected community death rates by 20%. So in other words, the higher the proportion of people who use track and trace systems, and the wider that information is shared, and then people then get the knowledge that in certain areas that maintaining social distancing is important, then there's a 20% reduction in infection rates. And consequently, without public disclosure, then death rates will rise. And I know there are debates about privacy and contact tracing apps, but secrecy at a time of viral epidemic costs, and to my mind that's too great a cost. Just as an aside before we conclude, there was some interesting research in a paper in ACS Nano that I was reading this week as well. And here researchers used aerosols of different sizes and challenged these against face masks. And these face masks were designed to move in and out with a typical respiration rate. And one aspect of this research looked at mask fitting. And it found that an ill-fitting mask with just a 1% looseness enabled 40% of viral particles to escape. So that was interesting in terms of that face masks not only are not reusable, but they also need to fit correctly and need to fit the face of the wearer. Otherwise, that's introducing a greater risk. Okay, so that's it for this video. Just a reminder to receive further updates on coronavirus or other science subjects that I might be broadcasting in the future. Please subscribe to my YouTube channel by clicking the link below. So I'm Tim Sandle. Till next time, please stay safe.